This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back. Well, the host might be losing it. I was supposed to say Pennsylvania politics and government in depth and in detail, and it all starts right now. It does all start right now, and sitting across from me is one of the experts we call in, Dr. Stuart Shapiro. He's the president and CEO of the Pennsylvania Healthcare Association. All right, look, states are facing huge challenges with health care. In all sorts of health care programs, nowhere more do they face a challenge than in Medicaid, which is, what, 20% of Pennsylvania's budget. And if that isn't fixed, if that isn't worked out, this is a huge problem coming up during the course of the budget debate for next year's Pennsylvania budget. Talk about the problems that you find with Medicaid and Medicaid spending.
Sure. Medicaid today is 22% of the state budget. The federal government, just starting this coming July, is going to cut back on the federal matching. So there's a budget hole. And there, frankly, are no simple solutions. Someone's going to say, why don't you just cut eligibility and take people off the welfare rolls? Right. You could work with that a little bit, but there are some federal rules around that. So that's not a simple solution. Right. Someone else is going to say, just cut the dollars you pay to all the providers, hospitals, doctors, nursing homes. That's not going to work either.
Won't that just raise everybody else's cost of health care?
Well, yes and no. What it will do, right now, hospitals and doctors and nursing homes are all underpaid under Medicaid. Right. And they make that, they're able to care for those people because they get extra reimbursement from Medicare, from private insurance. Right. And hospitals are easily, or relatively easier than nursing homes or doctors, to shift the payments from to ship the dollars into Medicare and into those other payers. For nursing homes, where 65% of the patients or the residents are covered by Medicaid, you right. can't make that up.
You can't make it up.
And what Governor Rendell did is he so expanded non-mandated services that he stopped paying adequately and paying for good quality care for those mandated services.
Give me an example of a couple of non-mandated ones. We've talked. Other folks have come on and talked about
He's expanded dental services, which are good services, but they're not mandated under the federal program. He's expanded chiropractic, some chiropractic services. He's expanded enormous good services in the home health care arena, but these are not mandated. And what the net effect has been is that the nursing homes, which depend on Medicaid, are now being faced with a frayed safety net. They lose currently, or they get under-reimbursed, $15 a day. They're under-reimbursed $5,500 a year taking care of Medicaid people. And with the Medicare cuts that came along with health care reform at the federal level, the availability of quality nursing home care is now going to be placed in serious jeopardy. And the Corbett administration, which is filled with, which is already filled, and they're adding more every day, very smart people, are now looking at how they can assure that that safety net is put back together, and that cuts are not made across the board, but are selectively made to make sure that the elderly in Pennsylvania continue to receive the care they need. Now,
does that mean that some of these non-mandatory services will be reduced or eliminated? I mean, is that, I realize you're not going to make up for the loss of $2 billion the state that will come to the state after, when the change in the formula goes through, Medicaid, payments to our state. But you can't get it out of just eliminating some of these sort of optional.
That's only part of the solution. And clearly the Corbett folks are, and I don't obviously speak for that.
Sure, of course.
But starting to eliminate non-mandated services, or certainly stop their growth, can result in millions and millions of additional dollars to put back in to keep a safety net from falling apart. There's a whole bunch of other ways that we can begin to address the inequities in Medicaid. But it's real important that
Go ahead. No. I want to pick up on just what you said. But what you're saying basically is, given the situation with the federal government, with the 14.3 trillion national big debt and long-term debt and the 1.5 trillion annual deficit this year, you don't expect any help from the federal government, do you?
Oh, I don't think I think we've got to find our own solutions in Pennsylvania. And the way I begin to think about it is, let's go back to basics. Let's make sure that those people who need services get quality services.
Right.
Back to basics.
Right.
Not expansion of non-mandated services. And now does this decision, do you think, have to be made as the Corbett administration approaches this new budget? His first budget is on everybody's mind. March 8th, the governor will deliver his budget message. I don't remember an anticipated budget message in modern times quite like this one. Do you think that he has to deal with this because, as you point out, 22% of the budget, right? Well, there's a lot of things he needs to do, but he has to address some of the problems that exist in Medicaid.
Okay.
And he certainly has to focus on eliminating any fraud. He certainly has to make sure that payment system...
Not easy to do.
But it can be done.
I understand.
The low-lying fat has already been removed. But there's still work that can be done, and Tom Corbett has experience with that. These are smart people.
Yep.
But the goal is to get back to basics.
All right, we're going to take a break. When we come back, one of the other topics that is big on the Attorney General, the new governor's agenda, is lawsuit abuse, and a bill was passed to deal with that. The governor vetoed it. I want to get into that with Dr. Shapiro. It's an important topic. All right, health care, it looms as a huge issue. It continues to be one, and we're going to cover it routinely on this show. Back in a moment. Hi, welcome back to the program. Talking, what are we talking about? Healthcare reform. What else would we be talking about on this show with Dr. Stuart Shapiro from the Pennsylvania Healthcare Association? All right. Governor Corbett, throughout the course of the campaign, said, yes, I'm in favor of lawsuit abuse reform. Point number 2, Doctor, Governor Rendell said he was for it, but then vetoed a bill. First of all, talk to me about what you think lawsuit abuse has to accomplish.
Well, first of all, Pennsylvania, according to a Harris Interactive study, is in the lower half in the United States of being a climate that's fair to citizens and fair to business in terms of lawsuits. Pennsylvania has so many frivolous lawsuits, and it's cost our businesses a lot of money. We need to stay competitive. And if you look at Delaware, they have a great lawsuit system. They're ranked #1, and they're right next door, and they're stealing our businesses because people would rather operate there.
Right.
Secondly, we need something that allows people to get fair settlements when something untoward happens, but we don't need the lawsuit abuse that currently exists. There's several pieces of legislation that are being introduced that have broad-based support. Governor Corbett has supported them. Governor Corbett spoke about it during his campaign. The House, the Republican, or the House of Representatives in Pennsylvania appears to be supportive of this.
Right.
They've passed some of this legislation in the past, and Governor Rendell vetoed it.
What are a couple of the big elements?
The first element is something called the Fair Share Act, which says that if in a lawsuit, if you apportion who's at fault, and then you ask them to pay their share of the damages. And that is what the Fair Share Act would do. Under current law, what's in effect now, if someone is 1% responsible but happens to have a deep pocket, what the lawyers do is they go after that 1% and ask them to pay the whole 100%.
Right.
And that is very, very, not only is it unfair, but it's anti-competitive. In the healthcare area, we're one of a handful of states that don't have something that is called apology legislation. And that's real simple. A doctor, a nurse, hospital administrator, if something untoward happens in the hospital, whether it's done by error or just something, it's just unfortunate, they want to be able to go up to a patient and say, this is what happened.
Right.
This is why it happened. We feel badly about it. And
now they're worried about doing this because if
they don't
it's
do
like
it
an
now.
admission of guilt, right?
Right. They not only they run, and unfortunately hospitals and doctors are trained to not admit even a potential error for fear it'll get introduced in court. So this would now allow people to have a good discussion. It's all the surrounding states have this. We're, as I say, one of a handful of states that don't allow this.
There's another aspect of this, and that has to do with punitive damages. That's pretty important. I mean, we're not now talking about the actual damage, meaning that, you know, if somebody, you know, has a problem in health care and they need additional medical care, they would get that medical care. If they lose some income, they would get that loss of income. But there's this aspect called punitive damages that is also a problem, yes or no?
Absolutely.
Explain that.
You take a city like Philadelphia, it's been rated the lawsuit hell of the United States because of some of the punitive damage awards. You need some caps on that.
Right.
And I think over time they will be put on. And the way some of the laws are written now, there's punitive damages limitations over how many times it can be greater than compensatory damages.
Right.
And some of the federal courts have said there ought to be a relationship.
Yeah.
They shouldn't be just wild punitive damage awards that have no relationship to real damages.
Right.
And so there's going to be legislation, I would suspect, introduced that's going to put some caps on that across our entire business community.
All right, we're out of time. I wanted to get a little bit, maybe you'll come back and we can sort of talk about what's going on at the national government with Medicare and Medicaid, huge programs that are, you know, just looming out there with, I've seen numbers, $45, $50 trillion, you know, over the long term. The cost of these programs as the baby boomers, you know, get eligible, and as, you know, given the recession, the number of people collecting Medicare, hopefully you'll come back, and I'd like to get into that at some point with you. Thanks a lot.